So as I alluded to, we will focus on the hip. What are the kinematics and kinetics necessary for the hip during running? So the hip joint angles. So you have the very similar uh, table setup that we had for the knee. You have the column headers of the different running speeds, and then you have the row headers of hip flexion, hip extension, and the joint excursion. So the hip's going to go through anywhere between 45 to 50 degrees during the running gait. And then we have flexion of necessary around 43 degrees at maximum. And then hip extension, people get, again, as you run faster, you can see that there's going to be more and more hip extension that is going to be necessary. When we look at the frontal plane, so the hip abduction and adduction, you want about at least 20 degrees. And then in the transverse plane, you want about 15 degrees of hip internal and external rotation. In what degree? Typically, people are looking at hip rotation in a flex position. Obviously, the maximum amount of hip flexion that is necessary here, at least if we're running at 3.7 meters per second or 8.3 miles per hour, that they're not going to get up to 90 degrees of flexion. So your internal and external rotation would be looked at in more of a neutral or slightly flexed hip, but not a 90 degrees flexed hip. When we look at the hip joint moments, so this is again looking at force or strength, and this is normalized to body weight. So it ranges for hip extension concentric and hip extension eccentric. The hip flexors really don't have a shock absorption capacity during running. They are certainly helpful and necessary with the swing phase, but during the swing phase, it's less likely that the joints will be disrupted, and thus we focus more on protecting the joints and with our criteria, and thus we focus on the muscle groups that are going to be most protective and most active during the stance phase and the shock attenuation. So we need approximately 47% of body weight force produced concentrically, and then eccentrically with the hip extension we would want about 37 up to 40% of body weight. Hip abduction joint moments. So we can see the different running speeds here. You can see that they're different running speeds than what was previously shown in the tables above and at the knee, and this is simply because it's a different study, because the study in question, Ordendorf 2018, did not look at the frontal plane hip moments, and so we can see here that the hip abduction eccentrically could be up to 7 times one's body weight, but the hip abduction eccentric, depending on the study that you look at, I think more appropriately, these would be better guidance metrics, would be 67 to 80% of body weight, depending on the speed at which someone's running. And again, these are tested eccentrically, because typically body weight norms for concentric or isometric hip extension would be shy of that. It would usually be between 20 and 30% of body weight. So the hip power. So when we are running, depending on the running speed, we are going to produce rate of torque development at the hip anywhere between 1.2 and up to 2.3 foot-pounds per second per pound of body weight. You can see that the greatest amount of hip extension work occurs at 6% of the gait cycle, with 0% being at initial contact, corresponding to the early stance phase where the hip is moving into hip flexion. So you would test them anywhere. If you wanted to be joint specific, that the hip is going to be anywhere between 35 to 40 degrees of hip flexion. Keep in mind that even in an isometric setup is that the joint angle can change up to 15 degrees. So it would be ideal to actually have the hip slightly more flexed than what would be, for instance, if you wanted to get the force production at 40 degrees of hip flexion, even in an isometric rig setup, it would be ideal that you're flexing the hip to 55 to even 60 degrees, with the understanding that when the individual pushes out that there's going to be some shift in the relative joint angle. And so that would be the recommended setup. And you can see here that the position would be prone, the flex to 90, the hip at 30 degrees, that's 30 degrees off of the flex position of 90 degrees. Sets and reps is 3 to 5 seconds. And then norms for the force that you would expect relative to body weight was described by Powers et al. When they compared a healthy cohort to a patellofemoral pain syndrome cohort, is that the PFPS group produced about 0.46 foot-pounds per pound of body weight, whereas the healthy group was over about 2/3 of body weight that they were able to produce. The outcomes that you're looking for, again, are going to be rate of torque development. I would encourage you to utilize their RTD 2080. Why is this the case? To date, that I don't know of any research that has looked at this as being, but we as far as like whether, like what is our rate of torque development metric or time point that would most correlate with the forces that are produced during the running. But what we can do is extrapolate and utilize what information we do have available, which is at the knee, and the knee is recommended that the rate of torque development 2080 is going to be a more those values are going to be more consistent with those forces that we see with running, rather than taking the torque produced at 100 or 150 milliseconds. Okay, and then if we look at the hip joint power in the frontal plane. So unfortunately, we don't have good data here in regards to the rate of force development that is necessary or that has been described by Ordendorff in 2018 at the different running speeds. This being said, we can look at limb symmetry indices as a surrogate, and we can also look at the normative values that were tested from again, at Powers et al., where they looked at the foot-pounds per pound of body weight. And again, it would be it seems as though eccentric forces of the hip abductors correlate better with running mechanics and differentiating the individuals that have pain with running than does the concentric or the isometric alone. But those values could still be utilized and better than just guessing or using an omnipotent judgment of someone's strength for the hip abductors. And you can see the setup here, the individual lying in the side lying position, hip at 0 degrees of abduction and flexion, so a neutral hip position, and same sets and rep setup as previously. So I alluded to on the previous slide about the importance of the type of muscle contraction out of the hip abductors. And so this slide just delineates that a little bit further. So isometric hip abduction strength has been unable to differentiate runners with patellofemoral pain syndrome from healthy controls, shows strong correlation in gluteal muscle force during running. And so because it's been unable to do that, additional hip strengthening programs have shown to improve hip strength, single leg squat mechanics, but no change on running mechanics. And so what's the deal? Why we know that this muscle is highly important for single leg stance and for gait. With walking, we would assume, presumably from EMG studies, that it is also highly active during running, but why don't our strength assessments correlate to the gluteal muscle force during running or differentiate our runners? Or if we actually strengthen them and show meaningful mechanical changes with our other functional tasks, why it doesn't cross over to someone's gait analysis, gait mechanics. So isokinetic hip abduction strength testing, particularly eccentric, shows a stronger relationship with running mechanics. And so I would make the recommendation that that is how we should be considering looking at this. So we can certainly test them isometrically for the rate of torque development, but it would be recommended if we want to really be sure that someone's mechanics are going to correlate with the muscle testing that would be done eccentrically. So same setup as you saw in the previous slide. The joint arc here is going to be 30 to 40 degrees. Speeds are going to be 60 to 90 degrees per second. And the sets and reps are going to be between 5 and 10 with 3 reps. And the eccentric and concentric are shown respectively. So you can see the mean values. So they should be around, for 30 degrees per second up to 60 degrees per second, around the same, honestly. It's going to be, for males, 62% of body weight up to 43%. And then for females, it's going to be a little bit lower, anywhere between 44 and 54% of body weight. But there is the upper and the lower bound as shown respectively. So the eccentric to concentric ratio should be approximately 1.4, meaning the eccentric strength should be approximately 43% stronger. And so an interrupted stroke test will likely yield more reliable and valid results rather than combining concentric and eccentric into a single set. So just from a coordination standpoint and methodology and protocol for testing, it would be strongly recommended that that it's considered to just use one set where you're only testing eccentric, and then do another set where you're testing concentric, and rather than trying to combine them both. And so these values that we see here also correlate a bit more readily to what we see with running, with the approximately 60% relative to body weight as far as the force in the frontal that's acting on the hip and the frontal plane. Yeah, I also just show that have been other positions that have been described. You can see the standing version there. I strongly, clinically, I found that the side lying position has been the better of the two options. But it's worth noting that there have been other positions that have been validated and shown to be reliable. Quick comment on hip abduction in the medial longitudinal arch at the foot. So key findings from the articles that you see cited there is that muscle strength at the hip, specifically individuals with normal medial longitudinal arch, generally exhibit greater hip muscle strength compared to those with pes planus orientation of their foot. Impact of hip exercises, incorporating hip exercises, particularly those targeting glute medius alongside foot exercises, can significantly increase the medial longitudinal arch parameters in individuals with flat feet. And I know we haven't yet gotten to the foot and the ankle in our discussion here, but we will when regards to the physical demands of running. And then the combined approach it also leads to a decrease in navicular drop and plantar pressures, enhancing arch height and stability more effectively than a foot exercise alone. Isometric hip abduction, during the short foot exercise, can increase the activity of the abductor hallucis longus while decreasing compensatory activity of the tibialis anterior. So you get a more coordinated muscle activation of the muscles that are ideal for supporting the arch rather than the compensatory ones. And this suggests that isometric hip abduction can be beneficial in strengthening the medial longitudinal arch and improving the foot mechanics in individuals with pes planus. And so as we'll see is that rapid pronation, the rate of pronation, as well as the extent of pronation of the foot are going to be something that's going to be important for us to help our patients to be able to control. But this just further drives home the point of the importance of the kinetic chain. And though we're talking about our kinematics and our kinetics by joint, recognizing that there is correlation across proximal to distal.